In this video, we are going to show you how to administer the intramuscular injection form of naloxone. Everything in the kit is packed in sequence from the red end. The yellow arrow is pointing at it. When you pull something out of the kit, you use it. The kit contents are a pair of vinyl gloves, 2 alcohol swabs, 2 3-milliliter retractable syringes with 1-inch needles that are 25 gauge in diameter, 2 1-milliliter vials of 0.4 milligrams per milliliter naloxone, 1 CPR face shield. Let's discuss what to do if you come upon an individual who has overdosed on opioids. In this scenario, we will demonstrate how to recognize the signs and symptoms of an overdose, administer naloxone by injection, and how to care for the victim during recovery. These are the steps to take in the event of an opioid overdose. If you come across a person who appears unresponsive, try to startle them to wake them up. First, you need to establish consciousness. Generally, someone who is overdosing on opioids is unconscious. If you are not sure if someone is conscious or not, yell in the person's ear or pinch the trapezius muscle. This is particularly important. If the person is losing consciousness and you startle them, you may be able to keep them awake and prevent them from going unconscious and stopping breathing. It doesn't always work, but it's something to try if the person is slipping away. Call 911 immediately after you determine the person is not responding. Next, examine the vital signs of the victim. The victim has shallow or absent breathing. Get your ear next to their nose and mouth and see if you can feel any air movement. Look down the body to see if the chest or the stomach rises and falls. Look, listen, and feel for air. Second, the victim may be foaming at the mouth. Third, the victim will have blue lips and finger and toenails from the lack of oxygen. Fourth, the person will have cold and clammy skin. Fifth, the person will have really tiny constricted pupils. You will likely need to pull the eyelids back to see them. Open the kit from the red end. The yellow arrow points to the red end. The first thing in the kit is a set of gloves. Put them on. The next thing is an alcohol wipe. Expose the shoulder, if possible, and wipe it with the alcohol wipe. Reach into the kit and remove the syringe with the naloxone vial taped to it. Tear the syringe out of the package. Flip the white cap off of the vial. Remove the sheath from the needle. Draw 1 milliliter of air into the needle, then insert it through the rubber stopper into the vial. Flip the entire assembly upside down and push the air into the vial. Then withdraw the entire 1 milliliter of solution into the syringe. Once the 1 milliliter is out, remove the syringe from the vial. Push the air out of the syringe. Tap it for bubbles and push those bubbles out as well. Once you see a drop of solution come out of the needle at the top, you are ready to administer. A couple of small bubbles like you see in ginger ale will not matter because we will show you how to administer the needle into a muscle and not anywhere near a major artery or vein. You need to find the right spot on the muscle to inject. This is called landmarking. We will show you 2 places to inject into the body. First, let's landmark on the shoulder. Put your finger on the edge of the victim's shoulder in the middle. Then you move slightly back. You should feel a ridge and a small gap between the shoulder and the upper arm. Put 3 fingers together and place them horizontally below the ridge. This should get you into the most muscular part of the shoulder. If it is a smaller person, 2 finger widths from the ridge may get you to this muscular area more accurately. Next, inject the naloxone into the muscle. While holding your fingers in place, insert the needle slightly below them. Don't go in from the back or the front. Only go into the muscle, oriented perpendicular to the shoulder. Don't jab the needle in. Just slowly push the needle through the skin and into the muscle. Once the needle is in the muscle, depress the plunger slowly until the naloxone is into the muscle. Once it is all in, count to 3, then slowly remove the needle. Let's discuss how deep you should go with the needle. The skin on the shoulder is anywhere from 3 millimeters to 6 millimeters thick, and each person has different muscle mass, creating some variability in how deep the needle needs to go for injection into the muscle. For the smallest of people, you will insert the needle at least half an inch or 12 millimeters on this inch-long or 25 millimeters needle. The bigger the person, the deeper you will go. If you don't insert it deep enough, you will just inject into the skin. The naloxone will work, but it will take longer, so it is important to get through the skin and into the muscle. Therefore, you need to estimate when the needle will be in the muscle. If you cannot easily access the shoulder, you can inject into the thigh, halfway between the knee and the hip. This is a palm-sized area on the outer part of the leg. On yourself, this distance can be estimated by stretching your thumb and your pinky finger out from the top of the knee along your IT band on the outer part of the leg. It does not have to be injected right at this spot. There is latitude to move up or down in either direction. The skin on the leg is thicker than the shoulder, and the muscle is deeper too. Therefore, I suggest that you inject 3/4 of an inch, approximately 2 centimeters, on this inch-long, 2.5 centimeter needle at a minimum. The bigger the person is, the deeper you will go. On the leg, just go through jeans, pants, or shorts, and do not worry about wiping the leg with the alcohol wipe if the skin isn't readily available. You can insert the needle from the front of the leg or from the side. Just remember to stay along the outside edge of the leg. Once you have removed the needle, depress the plunger hard and push it as far as it will go. When you do this, the needle will retract into the barrel of the syringe. Monitor vital signs after the first dose. If the victim does not have a pulse and you know CPR, initiate CPR. For performing CPR, a mouth-to-mouth face shield is included in the kit. Position the sheet on the person's face in the pattern on their face, with the foam disc over their mouth, and breathe in and out through the disc. Some certified CPR courses suggest only performing the compressions with CPR. Remember, the first rule of any first aid responder is to not put yourself in a hazardous environment, and the mouth and face can have hazards such as blood, mucus, or drugs. Follow your training. If the person is not breathing after 2 minutes, administer the second dose of naloxone. Perform the second injection in a slightly different spot, up or down, left or right from the first one. This helps to minimize damage to the victim's soft tissue. And remember to retract the needle when finished and put both of the needles back into the tube for biohazard contaminant. If the victim starts breathing on his own, whether it be after the first or the second injection, but is still unconscious, put the person in the recovery position. It is best if the left side is down. The recovery position helps to keep the airway clear in case the person vomits. If the person wakes up, get back quickly from him, at least 2 arms lengths. Verbally encourage him to wait for EMS, as naloxone only lasts 30 to 90 minutes. Whatever substance the person has overdosed on could last up to 16 hours, so the naloxone can wear off and the victim could overdose again on whatever he has previously taken. The naloxone may also have put the person into withdrawal, especially if he is a regular user of opioids. If this is the case, the person may want to go get another dose of whatever he had already taken, which could really compound the problem. So verbally encourage the person to wait for EMS, but do not physically restrain him. The expiry on the injectable kits is printed on the outside of the instruction sheet and on each individual naloxone vial. You can return used or expired naloxone kits to any pharmacy. Officially, your naloxone intramuscular injection is to be kept at room temperature, between 15 degrees Celsius and 30 degrees Celsius. However, new stability information tells us that naloxone is fine at 40 degrees Celsius or at 0 degrees Celsius for short periods of time, so it is fine to carry it with you. Do not leave naloxone in a hot car in the summer or a cold car in the winter. Naloxone freezes at approximately -15 degrees Celsius. If you suspect someone has overdosed on opioids, you can use naloxone to try to reverse the symptoms of overdose. If it turns out not to be an opioid overdose, administering naloxone will not harm the individual. There is a very slight chance that the victim is allergic to naloxone, but a rescuer often does not know this ahead of time. The good news is that the reaction is not usually serious. It is usually just a skin rash, and the rash does not necessarily preclude the use of naloxone. The Good Samaritan Act is in place in Ontario to protect you in case something goes wrong when you are trying to save someone whose life is in danger. Check your province or state's Good Samaritan Act to see if you will be covered if you try to save someone with naloxone. It is up to you if you want to administer naloxone. You are not obligated to do it. If you choose to do it, you will have the knowledge and the tools to do so. Let's review some basic principles of naloxone administration. Remember, you can start an opioid overdose rescue procedure with the naloxone spray, or you can start with the injection. Whichever you start with, administer the doses 2 minutes apart. When the victim starts breathing, you can stop giving doses. If the victim stops breathing again, you can resume giving doses. If you are administering the spray, try to establish a head tilt first. If you can't, or you think you might hurt the victim by moving her, spray the spray where you find her. If you are administering the injection, remember to landmark 3 fingers down from the edge of the shoulder. You will insert the needle into the muscle 1/2 to 1 inch, depending on the size of the victim. If you are administering it into the leg, landmark halfway between the knee and the hip. And remember, if you are going into the leg, you go a little deeper than you would with the shoulder, and you can go right through shorts or pants. Remember to retract your needles after use and place them in the tube for biohazard contaminant. Remember to place the victim in the recovery position if he is breathing but still unconscious. And remember to verbally encourage the victim to wait for EMS if he wakes up, but give him lots of space, staying a minimum of 2 arms lengths away. Remember your expiry dates, and remember that optimal temperature control is between 15 and 30 degrees Celsius, with short exposure between 30 and 40 degrees being acceptable, as well as short exposure slightly below 0 degrees Celsius. For more information, visit administeremergencymedicines.com.